Hi everybody, my name is Molly McNamee and I'm going to be talking to you guys today about Rocky Mountain Spotted Fever. So a quick overview of what Rocky Mountain Spotted Fever is. It's a tick-borne disease. It's caused by the bacterium Rickettsia rickettsii. It's most commonly transmitted by the American dog tick, the brown dog tick, and the Rocky Mountain wood tick. It's potentially fatal if it's not treated, and cases reported in North America and in South America. So here is a map of where the Rocky Mountain wood tick predominantly resides. It's in like the northwest area of North America. Here we have the American dog tick, so you can see it on the west coast a little bit, most likely in the Midwest, South, and East Coast. And the brown dog tick is pretty much everywhere in North America. So what do you do if you get bit? The first thing is not to panic. The best method for removing a tick is to use tweezers to grab the tick as closely as possible to the skin, and you want to pull directly upwards. It's extremely important not to break off the head under your skin, and once it's out, you can clean the wound with rubbing alcohol. If the tick has a really firm grasp of your skin and it's not letting go easily with tweezers, you can light a match and blow it out, and you put the warm tip on the tick. It'll make it really uncomfortable and it'll loosen its grasp and it should let go at that point. So some of the symptoms of Rocky Mountain Spotted Fever. The first symptom should develop within 2 to 14 days of the bite from the infected tick. In the most severe cases, it can be fatal within 8 days of the bite if it's not treated. It presents with sudden onset of fever and headache. It has a really characteristic rash, which you can see on the left here in these pictures. It presents with nausea, vomiting, abdominal pain, and loss of appetite. Red eyes is also a very characteristic symptom. How do you treat it? Doxycycline is by far the best treatment for it, and it needs to be started within 5 days of being bit. That is the window for reducing the risk of fatality the most. Other antibiotic treatments have not been found to be as effective. So what do you do if you can't take doxycycline, as if you're allergic to it? Chloramphenicol has been considered an alternative, but it has greater side effects and it's not as effective. It's been associated with gray baby syndrome and aplastic anemia. So if you're bit, if you can take doxycycline, that is the most effective treatment. Prevention, the best preventative method for not being bit by ticks is to wear long clothes and socks while outdoors in woodsy areas or while hiking. So I Googled pictures of hiking and I found this is one of the first results to pop up. And you can see they're in sandals and shorts. So they are going to most likely be bit by a tick because their skin is exposed. Again, here they're hiking in shorts. It's not ideal. So we don't want that. These people are hiking with closed-toed shoes and long pants and long shirts, so that is what we want. Again here, pants, shoes, shirt, that is proper hiking attire. Another preventative method is to inspect your body after playing or working outside and to keep tweezers and matches on hand if you are someone who does so often. Also be aware of the signs and symptoms of Rocky Mountain Spotted Fever, as well as other common tick-borne diseases. More on prevention, it's really important to take proper care of your house pets. Tick can attach themselves to dogs, cats, any other house pet, just like any other animal out in the wild, and cause them harm. So pets can carry and transfer these ticks into their homes, and so it's really important to apply flea and tick preventive medication to your pets as often as needed, and take your pets in for annual checkups to have them screened for vector-borne diseases. So in conclusion, outdoor exercise is a great way to stay in shape and maintain a healthy lifestyle. But if you live in an area that's surrounded by woods, tall grass, or lots of trees, you might want to consider taking preventive measures to protect yourself and your family from tick bites. Rocky Mountain Spotted Fever is just one of many extremely harmful diseases that ticks carry, so immediate and careful action needs to be taken if you are bit by one. Take care of your pets. They can be affected by ticks too. They can also be a vector for transmitting these pets into your house, beds, or furniture. Thank you.